Let's, as I mentioned, let's fasten our seatbelt. Let's start our journey with the standards. If we are talking about the track and trace standards, we are talking about GS1. So let me invite Dr. Haytham Abdulatif. Dr. Haytham Abdulatif is the head of regulatory solution in GS1 Egypt. Dr. Haytham,
Yes, thank you.
how are you? I will
Yeah,
drop my sharing. You can share your screen.
thank you so much. Can you see my screen?
Yes, Doctor. Yes.
Yes.
Yeah. Thank you so much, Dr. Ahmed, for invite us to join this webinar. It's really honored to join all the audience to this webinar, and this is a global webinar. And let's start our journey today. I'm Haytham Sabri, head of regulatory solution in GS1 Egypt, and I have some experience in the track and trace. So we will start with welcoming. Good day, everyone. Today, I will introduce GS1 standard and how they support traceability and visibility in the pharmaceutical supply chain. This introduction, we will start with the big picture before moving into identification, capture, and data sharing. Okay. This is our agenda today. We will start with covering GS1 standard in healthcare. As I said before, we will start with identification, data sharing, capture, sorry, and then sharing the data. Let's start with overview about GS1. GS1 is a global standard organization. It works across many countries and sectors, including healthcare, to create one common language for the supply chain. We have more than 24 commercial sector and more than 6 billion daily transactions. You said deep in many countries, and GS1 in Egypt from more than 28 years, and we have more than 10,000 product owners as a member. And this is our strategic partner in GS1 Standard in Egypt, and also the GS1 Healthcare User Group. It's from the leaders from the pharmaceutical and medical device countries in the world. And also we had worked with the Global Healthcare Organization, ISO, WHO, and all other global or healthcare organizations. So let's start with the track and trace mean what? Track and trace means monitoring pharmaceutical products from the production until final delivery to the patient. And track and trace answer four main questions: what, when, where, why. And we will answer these four questions through the presentation. Tracking versus traceability. Tracking tells us where the product is now, and traceability tells us the full history of the product journey from the commissioning to the dispensing. This is the name. And I would ask the participant if you can just write what the value do you think track and trace bring. I think all of us have an value about the benefits about the track and trace. If you can share it, or Dr. Ahmed, you can help me to define some value in the track and trace, if you please.
Yeah, Dr. Haythem, I think one of the values of the track and trace is fighting the counterfeit. This is the major value of the track and trace is to fighting the counterfeit. Of course, we have some other values like saving the brand authentication, as Mr. Marwan also mentioned, stock level visibility. It gives a lot very much effect on the KPIs of warehousing, of course.
Thank you, Dr. Ahmed. This is the main benefits or the main value for the track and trace, enhancing patient safety, regulatory compliance, efficient recalls, counterfeit prevention, and maybe supply chain visibility, inventory management. This is some of the main values of the track and trace. Thank you very much. And then traceability depends on 4 building blocks: unique identification, data capture, data communication, and linking physical flow with information flow. And we have 2 main approach for the track and trace. A safe supply chain needs identifies authentication, tracking, and tracing. Global standards help countries fight counterfeiting and improve product integrity. The traceability is a track and trace. Track means where the product or the object now, and the trace is the history and the location. Also, traceability is for the regulatory body, and it's traceability across the board. It's not for just local for countries, but it's for abroad and for the countries to have some visibility and enhance the commercial together. This is for the safe supply chain, and the key recommendation for this or the roadmap for the countries. It have an recommendation as a 6 recommendation for all the regulator in the world want to have a successful track and trace. The key recommendations are defined, clear objective, collaborate with the stakeholders, and use global data standard. Without these systems, become complex, costly, and difficult to connect. We will have the first recommendation here. The first recommendation to have an clear define the objective for the track and trace. As we mentioned before, track and trace have recall improvement, product protection, supply chain visibility. The first step or the first recommendation to have a clear objective to the track and trace implementation. And there is some dilemma for didn't have a clear objective, as unclear what the solution is addressing. Processes will be complex, timeline may be extended, cost can be increased. The second recommendation is to collaborate with the stakeholders, the regulator, and maybe manufacturer, 3PL, CMOs, distributor and the pharmacies, hospitals, all the stakeholders have to have a collaboration with the regulator. And also the dilemma will be as the process will be very complex and timeline sure will be extended if and cost will be increased if they lack of collaboration. The third one is using a global data standard uh, to make enable global product identification, and this may support efficient and effective the management of the supply chain and harmonization between the countries and each other. And they will start with the module 2. It's the GS1 identifiers keys. This is the main three magic words in GS1 standards for the track and trace: identify, capture, and share. We will start with the identify products and locations. The JITN identify trades such as medicine, medical device, and packaging label. It can also be connected and linked with the expiry date, batch number, and serial number. The main identifier key is JITN for identifying the product, and GLN to identify the location and the legal entity. Then SSC, serial shipping container code, for identifying the logistic unit. This is the main three identifier in GS1 for the track and trace. And this is a slide for identifying each pallet with the SSC, the case, JITN, and SSC item by the JITN manufacturer GLN. This identifying key for the whole track and trace. And then we will talk about the GLN, the JITN. JITN is a unique identified. It's for 14 digits from the GS1 company prefix. Then the item identified, you will explain it. The first, it's 3 digit, it's a country code. And then the complex company prefix, it's manufacturer or brand owner, and then serial number, it's identified for item reference, and then the check digits. This is the structure for the JITN 13. And also this is the identifier for the packing level from single unit, primary packaging, secondary packaging, case, and finally the pallet. And this is what the regulator mainly requires for the 2D data metric with the JITN. JITN expiry date, batch or lot number, and serial number. And this is the SSC. The SSC is used to identify the logistic unit. This is the main JITN versus SSC and the logistic unit. JITN to identify the trade item, and SSC to identify the logistic unit. This is the main difference between JITN and SSC. JITN in 2D data matrix, SSC captured in 1 to 8. And we will have a GLN. GLN, it's GLN identified who and where companies, sites, warehouse, pharmacies, or the delivery locations. GLN have 13 digits. And this is example for the GLN the party who the government body maybe, and the accounting corporation. This is who as a legal entity, and also the location. GLN identify the location as a physical location, the distributor, the manufacturer, pharmacies. This is the main two function for the GLN. And this is an example for the GLN from the corporate entity as a legal entity, and identify the distributor, stores, and maybe accounting department. And this is the AI application identifier for the different types of GLNs. And this is the GLN structure. GLN structure, this is the application identifier for the physical location, and the first three for the country, first three number for the country code, then the company prefix, and then the location reference, and the last number for its check digits. Now we have the identify part in the GS1 standard, and we will have the third module, and it's a capture for the data. We will move from identifying data to capturing data. Data capture can be done by using the barcode or using the RFID. In healthcare, we commonly use the 1D barcode, sorry, and the 2D barcode, and GS1 data matrix. One D barcode stored limited data. EN13 usually carries only the JITM, while GS1 1 to 8 can carry JITM plus expiry date, batch number, and serial number. For the for the 2D barcode, store more the data in a smaller space. GS1 data matrix is very important in healthcare because it supports traceability and patient safety, as we said before, and also all the regulator which apply GS1 standard using the 2D data matrix as a in the track and trace capture. It covers data capacity more than 2,000 characters. So it is the first choice for the regulator in the track and trace. And also we had an HRI. HRI means human readable interpretation. It is very visible text under or near the barcode, allowing manual reading if scanning is not possible. So it's also one of the main requirements for the track and trace in the capture. So we had covered identify, capture, and we will moving to the sharing data without proper data exchange. Information stay in silos, and partners don't have one single version for, of the truth. So the supply chain, the ABCIS, one of the GS1 and ISO standard that enable the supply chain partners to share event data. It supports visibility and interoperability, but it's not a ready-made solution by itself. As I told you, and it's an open source from GS1, and also ISO compliant with the ABCIS. So the benefit of ABCIS include real-time tracking, better traceability, improving compliance, transparency, recall management, and data-driven insights. And this is the product life cycle from the perspective of the track and trace, from the commissioning, packing, aggregation, shipping, receiving, unpacking, dispensing, transformation, and also error declaration and decommissioning. And this is to conduct or to conclude. We have identified the main 3 pillars in GS1 standard for the track and trace. We have identified and captured and finally shared. GS1 standard help supply chain, healthcare supply chain to identify product, capture accurate data, and share trusted information. And thank you very much for your time. And this is my email and the email of healthcare in Egypt and GS1 Egypt. If you have any question, it's more than welcome to answer it. Thank you so much.
Thanks very much, Mr. Haythem. It was a very cool presentation, especially getting the value. I think is something that Ahmed an ongoing discussion counterfeits. So thank you very much.
Thank you, sir.
I think, Justin, it is an opportunity to, we need to use it because Dr. Haythem, I think, aware about the status of the track and trace in Egypt. So, Dr. Haythem, can you give us a quick brief about the status of track and trace in Egypt?
Yeah, sure. As you know, Dr. Ahmed, the track and trace in Egypt, the track and trace project has already moved from maybe the planning into implementation. Imported pharmaceutical products started to launch gradually in Feb this year. The first phase focused on the imported controlled medicine using the serialization to track each pack digitally. And the local products are planned to be launched in August this year. And the system will expand gradually until it covers the Egyptian pharmaceutical market.
Very good, very good. Thank you, Dr. Haythem, for your attendance. Thank you for the session. Thank you for the valuable time. Thank you very much.
It's my pleasure.
Okay, Justin, I think it's time to move for discuss the status of different track and trace in different countries. It will be a very rich sessions in the next couple of hours. We will start by the status of the track and trace in Algeria. So I would like to invite Mr. Mahdi. Mr. Mahdi is the Director of Information System and